With a coronary CT angiography, the diagnosis of a coronary stenosis is done easily within clinical routine. But what about the functional relevance of an intermediate lesion? Will the patient actually benefit from an intervention? With its evaluation of dynamic myocardial perfusion, syngo CT myocardial perfusion provides information about the myocardial blood flow and myocardial blood volume, might aid in the assessment for the hemodynamic relevance of intermediate stenosis of the coronaries. This helps enable you to choose the right diagnostic approach for every patient.
The typical clinical procedure consists of a coronary CTA for assessment of the coronaries, followed by a stress examination with the heart VB10 dynamic protocol on Siemens stomatom force or stomatom definition flash scanners. The acquisition is triggered at a systolic phase, where the thicker myocardium allows a better assessment of potential perfusion defects. Regarding contrast media, good results can be achieved using the protocol proposed in the attached publication. This movie will show you how to evaluate CT myocardial perfusion datasets using syngo. First, make sure that the study is correctly assigned to the CT myocardial perfusion workflow. Otherwise, click the right mouse button and select Open with CT myocardial perfusion. The patient data will be opened in a layout that consists of the temporal data displayed with 3 MPRs on the top of the screen, a lower left segment with a temporal MIP for better assessment of the vessels and the heart cavities, and a temporal average on the lower right segment for better assessment of the myocardium. Navigation can be done in any of these segments by dragging the mouse vertically while pressing the right mouse button. Window corrections can be done by dragging the mouse vertically and horizontally while pressing the middle mouse button. To navigate through time, use the upper segments and drag the mouse horizontally while pressing the right mouse button, or simply move the time slider. The first step of our workflow allows motion correction. Just scroll through all time points to detect a good time point with minimal motion that could be set as a reference. Notice how the small triangle changes, and click the Align button to apply motion correction. If motion artifacts are observed in some time points, it is better to remove the corresponding points beforehand. After optional motion correction and deletion of critical time points, go to Step 2, Segmentation, where the 4D noise reduction can be run to reduce image noise. This is especially helpful if the data is noisy due to a protocol with low MAS. Automatic segmentation of the myocardium is performed in this step. You can use the Segment Myocardium option if manual correction is needed to optimize the contours of the myocardium. When switching from Step 2 segmentation to Step 3 vessel definition, 2 references, cranial and caudal, in the aorta are detected to optimize the temporal sampling of the arterial input function. Vessels and heart cavities are depicted in magenta. Use the window function to adjust the mask if manual correction is needed. If you are satisfied with all inputs in Step 3, go on to Step 4, Results Preview. In this step, you can quantitatively assess the result volumes to ensure that they are adequate for further evaluation and archiving. Just make sure that the volumes that you want to proceed with are selected. If quantification is needed, proceed to Step 5, Results. All hemodynamically relevant perfusion parameters are displayed in one view, including myocardial blood flow, MBF, and myocardial blood volume, MBV. More parameters can be added at the configuration dialog. The VOI and the freehand and the elliptical ROI functions provide you with an accurate quantification of the areas you select for comparison. Additionally, you can easily use the time attenuation curve plot and the statistical analysis for further quantitative assessment. Do you want to compare different evaluations, for example stress and rest or first pass enhancement, dynamic CT perfusion and late enhancement? Then click on the Save and Send button and open the patient data with the CT cardiac function workflow. The perfusion evaluation step enables the simultaneous assessment of the full spectrum of the myocardial perfusion. This includes first pass and late enhancement, dual energy perfused blood volume, and quantitative dynamic CT myocardial perfusion data, such as blood flow and blood volume data. All the existing series are available in the drop-down list of the result gallery. To compare different evaluations, just select one of them. The anatomical image will appear as a thumbnail, and all the results available will be displayed in the result gallery as polar maps. Drag the corresponding result to one of the 3 volumes of the layout. Proceed similarly to the rest of the evaluations to compare. The polar plot visualization and the direct overlay in short axis and long axis views helps to pinpoint the perfusion defect. All results are conveniently collected in a report. To save and archive this report and the results series and to complete the workflow, simply click on the Save and Send button.